obesity is one of the major causes of problems after you have a joint replacement. My tennis elbow is gone. I think it's because of carnivore, because you're not having all those inflammatory mediators, partially because I've lost 50 pounds of fat, partially because I'm not eating those things. January of this year, 24, I started carnivore, and I lost 20, 30 pounds in the first 2 months. What I really want to do is transform the health of my patients, right? And that's the goal. That's what, regardless of what specialty in medicine, that should be your underlying goal. You want to transform the health of you want your patients to be healthier. It's criminal what they tell people to do. They tell people, eat carbohydrates and take your insulin.
Dr. Rick Godding. Where are you, Rick? Where are you located?
So I'm in Des Moines, Iowa.
You're in Des Moines, and you're an orthopedist, correct?
I'm an orthopedic surgeon.
We've got a kindred.
I actually work outside of Des Moines in a small town, and I live in Des Moines on the weekends with my family, and that's a super long story. But anyway, that's where I am right now.
Gotcha. Okay. As you may know, I'm also an orthopedist, or I was for many years until I got into more of this lifestyle-related stuff. And one of the things that I think my focus has been on nutrition for a number of years now, and nutrition as it pertains to disease. Orthopedics is probably the least nutrition field there is, I think. I just don't care about it. I don't know. It has a role, but it's like, there's no, you can't go to look like the Orthopedic Knowledge Update or any of the textbooks and say, you can treat this disease using this particular dietary scheme. This is not there. We're very much surgeons, and everything's like procedure. I think we're one of the most operative specialties there is. It's just a lot of operating that we do. And I know you look like you're going to say something.
I think it's true. I think it's true in the past, but I think that my practice, since I've started the carnivore lifestyle and been really engaged in metabolic health, I've found a lot of things that I've been missing. Yeah. For instance, if you give a patient who's going to have elective knee replacement surgery probiotics, they have a lower infection rate. They have a lower rate of postoperative cognitive decline, which you do see in some of your older patients. There's just and this is not, this is literature. This is medical studies that I started looking at finally. In addition, I give my patients essential amino acids because there have been studies that show that the wasting of the quadriceps muscle, so for those of you who are not orthopedic surgeons, the front of your thigh muscle shrinks less after a knee replacement if you give them essential amino acids from the week before to a month after surgery. So now I give all my patients essential amino acids who are going to have surgery because I extrapolate that out to, hey, why not? This is a zero risk proposition. And so all my patients that come into my office essentially now get essential amino acids and probiotics. And not just surgical patients, because for the I'm just going to explain it. I know it. I'm just explaining it for the listeners. Sarcopenia is something that you see as you age, and sarcopenia is the wasting away of muscle. And the ways you can fight that is to eat enough protein, but a way to supplement enough protein. So first you have to convince your patients to eat enough protein. And then if you can give them essential amino acids, now essential amino acids for the viewers are those amino acids that you cannot manufacture in your body. So you can manufacture 11 of the 20 amino acids, but there's 9 that you cannot manufacture. And so you have to take them in a dietary sense. So if you supplement those, you can actually do better. So my practice has really shifted in its orientation towards a much more metabolic health type of practice. And I have lots of my patients who have lost a lot of weight on the carnivore diet or ketogenic. I tell them, look, carnivore, ketogenic. I even tell them, any kind of diet that is going to get you to lose weight when you're 300 pounds is good. Mm-hmm. I support it. But I've got a lot of my patients who get on the carnivore diet and they lose a lot of weight and they do better. And as the viewers may not know, but obesity is one of the major causes of problems after you have a joint replacement. Infection, stiffness, all kinds of terrible problems can happen if you've replaced somebody's joint and they're obese. So I try to get my patients not obese anymore. So it really is kind of transformed my practice for sure, as well as my life, 100%.
Yeah, that interestingly, that very exact issue is what got me down this road. This was way back in 12. And we were, as a community of orthopedists, we're saying, hey, we got a lot of big patients, a lot of obese patients, higher, as you mentioned, high infection rates. They didn't rehab as well, blood clots, the whole wound complications, on and on. With a total joint, you don't want bad wounds. That's a nightmare, obviously. And so as a community, we said, hey, let's not start operating on people unless their BMI is below 35. And you got a lot of people with BMI 40, 45 rolling into your clinic wanting a knee replacement. And I was like, well, how do you get them there? There was no guidance. Just figure it out yourself. And I was like, at that time, I was on a ketogenic diet. So I was putting my not all of them will do it. But one of the things I saw is that, one, some of the patients, their knees stopped hurting, which I thought was really cool. And we were like, well, if your knee doesn't hurt, we don't need to operate on you right now. Like I said, that's one of the major indications for a joint replacement is severe intractable pain. And the other thing that I would see is the patients that I would bring to surgery, they would just do better. They'd have less pain postoperatively. There'd be less wound drainage. They'd be sitting there post-op day one. This is back in now a lot of these joints are done kind of outpatient, but back in the day, keeping 2-3 days. They'd be sitting there just chilling on day one, which was not what I was normally seeing. A lot of times patients would be still having some pain. You'd hit them with the PCAs and the oral meds and the anti-inflammatories and the whole and the catheters and pain catheters and whatnot. But still, it was just remarkable to me that these patients were clearly doing better. And that sort of set me down this road of, hey, wait a minute, nutrition is really important here. And we know that like wound healing, it says in the literature, which I've looked at, increase your protein intake 10-15%, just like you mentioned before and after for a month after. So it starts to make sense there. But one of the things I was interested in was I was like, I think I was just like guessing on something. So I said, I bet these people with carpal tunnel syndrome have some level of metabolic dysfunction. I was testing insulin levels on people with carpal tunnel. I got some really weird calls from a lot. Why are you asking for insulin on this diagnosis? It was like, because it didn't make sense. But I was seeing really high insulin levels in people with carpal tunnel syndrome. I was thinking, so in my view, and you can correct me if that's not your experience, but I think that a lot of the common orthopedic conditions, arthritis, tendinopathy, peripheral compression neuropathy, those types of things are probably related to metabolic disease. And I think when you start addressing that, they get better in many ways. I don't know. What's been your experience?
100%. So there's a lot to unpack here. First of all, adipocytes are the cells in fat. Okay, adipocytes. So if you have more fat, you have more adipocytes. It's just more of these cells, and they're bigger. They secrete what are called inflammatory mediators. Inflammatory mediators cause inflammation throughout the body. So we used to think if you lost weight and your knee stopped hurting, it's purely a mechanical situation. The knee is supporting your weight, it's supporting less weight. Now we're coming to understand that in reducing the fat cells, the number and the size of them, you're actually reducing the actual things that cause the inflammation in the joint. So you can actually stop that joint destruction by losing weight. My personal experience, and we'll get into my whole carnivore story, I'm sure, I had tennis elbow, and I had one corticosteroid injection, and then I had a platelet-rich plasma injection, which is they drew some blood out of me and then spun it down, and then I actually injected myself. But I put it right where it's supposed to be. It didn't help. 3 months into carnivore, my intractable tennis elbow, which I was almost certain I was going to have surgery for, but was putting off because me having surgery means I can't do surgery, right? So it's a big cost as far as like lost wages and revenue and all that. My tennis elbow is gone now. And I think it's because of carnivore, because you're not having all those inflammatory mediators, partially because I've lost 50 pounds of fat, partially because I'm not eating those things. So it's not just fat cells that give you these inflammatory mediators. It's the wheat, especially the modern wheat that we're eating in America, all of these things. Yes. We, as orthopedic surgeons, are trained to fix a particular problem. And one of the things I really enjoy about my practice now is that I'm trying to help people avoid these surgeries that we just thought that's what you do. You know, that's what you do. You put a new knee in. And now I'm thinking, man, listen, maybe we don't need a new knee. I had a guy my early experience back when I was practicing on Kauai, probably 15 years ago. I had a guy and he came in, he had bad knee pain. And I said, you got to lose weight. And I didn't have a method for him at that time. I just said, you got to lose weight. He came back in 6 months later. He had lost 70 pounds. He said, my knees just don't hurt. And that was a nugget that made me think maybe we're just doing too many knee replacements.
Yeah, and that whole mechanically, the knee joint bears 4 times your body weight through the joint, or some multiplier, and that's what I was trained to believe. And then it turns out it's biology. But it's interesting because you mentioned your lateral epicondylitis, your tennis elbow. I had right quad tendonitis for 10 years, and I tried everything. I tried all eccentric stuff, all the different tricks we try to do for our patients. None of it helped. I went carnivore and it went away in 2 months. I was like, shit, this is pretty cool. And at the time I was 50. So it's one of those things that I knew. The same thing. I remember a patient, I can specifically remember many years ago, a lady coming in telling me that every time she ate bread, her knee hurt. And I thought she was you're just crazy. Whatever. You got a long allergy, you're a wacky patient. I just dismissed that. But in retrospect, I was completely wrong. She was completely right. And we see that time and time again. I see people that give up sugar and wheats and refined carbohydrates, their joints just feel better. And I think there's that inflammatory dietary component, but you're absolutely right with the adipocytes spitting out all these inflammatory cytokines. It's biology so much, probably more so than it is mechanics in many ways, which is mind-blowing to an orthopedic surgeon who's trained to think about angles and all the force and all that type of stuff.
Yeah, I just took my recertification examination yesterday. Last time I have to take it, and there was nothing about nutrition on that whole test. And I would guess that if I was a family practice doc, my nutrition questions on my recertification means I've done it for 20 years now. So I take a test and that means I'm still board certified. And so this is the last time I have to take it because I will not practice for 10 more years. I'm 20 years in. I would guess that if I was a family practice doc, that the nutritional questions would have been 1, minimal, and 2, erroneous. And I don't know that, but I'm just guessing. And there was nothing, all this new literature about how metabolic health affects orthopedic patients. There were 0 out of 150 questions. Now, I got questions on what should I do with a patient with cerebral palsy who has a hip dislocation at 18 months old. I will never, ever treat that patient. I will never treat that patient. So even the American Academy of Orthopedic Surgeons has this all wrong. They are not telling the general orthopedic surgeon, if you improve the health of your patient, and that is within the spectrum of your scope of practice, you can help your patients avoid some of these big surgeries that do occasionally have big, bad complications. And so there's a lot of work to be done. And that's why I have a YouTube channel, because I want to help do that work. And I mean, you inspired me. And when I started the carnivore diet, I guess I might as well tell my carnivore story, right? So I've been off and on obese my whole life. My first, I guess, instance of carnivore was the ketogenic. It was actually the actual Atkins diet when I was 14, leaving junior high, or 13, 12, whatever, leaving junior high, going into high school. And I was the fat kid in junior high. And I had been the fat kid basically my whole life. I'm like, I got to start high school and I do not want to be fat. And my mom said, hey, there's this really wacky Atkins diet. And I said, let's do it. And I lost a bunch of weight. And then I got into high school and I started wrestling and I didn't have to think about it again. And then I got into college and I started drinking beer and eating pizza and I got fat again. And I was young enough at that time that I could out-exercise that. So I got fat, so I just exercised it away. As I got older, I started doing more radical things like P90X and Body for Life. Body for Life is awesome. That's a great program.
Philip's old program. Yeah, I remember that when it came out. Yeah.
And I lost a bunch of weight doing that. But if you can sustain that, you're more disciplined than me. I'll just tell you, it's crazy. You got to get up in the morning early and work out every morning. You got to eat every 3 hours. So you're packing your lunches. You go to work with a backpack full of little snacks. It was just too much. So off and on, back and forth, fat and not fat, fat and not fat. And over the last 4 or 5 years after I turned 50, I got back into ketogenic. And I would do ketogenic and 5 nights a week, I would have a salad with mostly Greek salad. I would make my own dressing, very healthy, like olive oil and vinegar, a nice little salad with feta cheese and some salmon or some chicken. But then on the weekend, I would go a little off, and I would have a slice of pizza. And I was working out like crazy. I could not lose the weight. And then I was a big Jordan Peterson fan based on other things that he was talking about. But he started talking about, I only eat meat. I was like, oh, that's weird. Okay. Mm-hmm. And then I saw you on Rogan, and then I started looking into it. And so January of this year, 24, I started Carnivore. And I lost 20, 30 pounds in the first 2 months. And now I'm down between 45 and 50 pounds. It depends on that. But I'm really working more on body composition now. I'm lifting hard. I'm doing kettlebells. I started sprinting because actually Dante Ferrigno's channel got me interested in sprinting and reducing visceral fat and all that stuff. So now I'm all in. I got my YouTube channel. I've transformed my practice. I've transformed my life. And I would tell you, I'm probably having the most carnivore weekend of anybody on the planet right now, because I'm sitting in a hotel room in La Crosse, Wisconsin. I just had a great morning mountain bike ride. I am on my way to Montello to meet up with Carrie Mann from Homestead How. He's having a meetup, and I guess Dr. Kiltz is going to be there. And the meetup is going to be at this theater that Carrie owns. So I'm guessing we're going to get a preview of his documentary. So I'm full throttle carnivore this weekend. And talking to you, so it's like this whole giant.
Awesome. Yeah, I wonder if the film's done shooting yet. I know. I did an interview for that movie that Carrie's doing, and good on him for doing that. What was I going to? Oh, there's a quote. One of our members asked a question. I was asking, how quickly do you see inflammatory issues go down on diet when you change diet? I've seen it happen very quickly for some patients. I tell people to give it 3 months. For most people, has been my experience, but you can see very rapid. I don't know what your experience has been now that
3 months is a magic number in physiology. Yeah. And 3 months, your fractured bone will heal. That's about 2 to 3 months is when my tennis elbow finally went away. So yeah, I think 3 to 6. After 6, maybe it's not going to happen for you. Maybe you need something else. But yeah, 3 to 6.
Yeah, I think that's fair. That's fair to say. So here's the deal. When I was practicing, and it was pretty busy, guys, it was not unusual for me to have 45, 50 patients on my schedule for the day in clinic, and plus seeing PAs, plus answering ER phone calls, plus being on call and having to run to the OR and fix a hip or something like that. You're busy. And this is back 2012, 2013, and I'm talking to patients about lifestyle. All I could do was say, hey, go watch this video. Here, maybe go read this book. There's no support. And I don't know what your experience is within your practice, but I find that there is very limited support. In fact, it's almost discouraged. In fact, when I started, I was the head of the practice. I was, the head of the orthopedic group, but I still had to work within the administration. I talked to the administrators about having a half a day to talk about lifestyle related stuff. And they were like, nope. It's not on the menu, dude, because the appetite was, as an orthopedic surgeon, you turning that wheel drives the revenue for the hospital, and they don't want you slowing that down. And so I just don't think there's a lot of resources that you have at your disposal now. Maybe in your practice, you've managed to figure that. Do you find impediments to being able to practice lifestyle as an orthopedic surgeon?
So I just slide it in there. My hospital administrators are more than happy that I'm doing what I'm doing. They would not at all, nor would I really think that I'm qualified to take that time out and give them a 30-minute office visit on it. But what I guess what I would like to do, this is all real new. This is like a drinking from a fire hose for me, because January is when I started this. So what I have done is I've changed all my patients. Like I said, they're getting essential amino acids. They're getting a lecture about weight loss. A lot of them are losing weight. The next thing I'd like to do is incorporate I've been reluctant to sit down with the dietitians at the hospital and try to get things together, but I'm going to do that this year. And when I say get things together, Like, I want all my hip fracture patients. They're actually doing a study at the University of Iowa on essential amino acids and hip fractures. So I want all my patients who come through the hospital to get essential amino acids and probiotics. But what I really want to do is transform the health of my patients, right? And that's the goal. That's what, regardless of what specialty in medicine, that should be your underlying goal. You want to transform the health of you want your patients to be healthier, right? So in order to do that, I want to implement a situation where when a patient comes in to see me, I can say, okay, look, you're obese, you're having some shoulder pain. I'm going to give you your injection. I'm going to give you your anti-inflammatory medications. I'm asking you to please go see our dietitians, but I can't send them over to the dietitians until we have a talk. And they're not going to go tell them some ADA, these failed nonsensical nutritional advice paradigms that come from the standard, like I said, the American Diabetic Association. It's criminal what they tell people to do. They tell people, eat carbohydrates and take your insulin. I can't do it. I can't send somebody to that.
I'll tell you 2 points. One is the concept of protein and fracture healing, because when and maybe I missed this, but protein really wasn't emphasized to my knowledge. And even in our specialty, it was more calcium, vitamin D. And when you look at the skeleton as type 1 collagen, it's a lot of protein in there. And it hadn't been an emphasis that you would treat a fracture with protein. That was not something that I was trained about. I don't see much in the literature on that. That's actually like that we saw. It's, yes, you need protein. It should be obvious, but it's not been something we focused on.
It's not the fracture healing itself. There's going to be no difference in the fracture healing that I know of. It's the muscle it's the muscle wasting that you're not getting if you eat the appropriate amount of protein. So with the hip fractures, they're not saying that these hip fractures are going to heal the actual bone quicker. What they're saying is they're going to lose less muscle mass through the process of the rehabilitation, and therefore they're going to rehabilitate quicker. So no, it's not a fracture healing. It's definitely a muscle loss issue.
It is, the muscle impacts the bone, obviously, through loading. But there's
right? There's Wolff's Law. Muscle stresses across the bone make the bone remodel in certain ways. If you have, for instance, if you change the angle of a bone by a fracture, then on the angle of the bone where there's going to be more stress, it's going to grow more and repair more. So you can extrapolate that to the muscles around it. If they're stronger, yes, they're going to make that bone probably heal a little faster too. Now, there's no data on that, but there's certainly data on, like I said, the circumference of the quadriceps after a total knee replacement, either on or not on essential amino acids. And they shrink less on essential amino acids. And I think that's what the University of Iowa is looking at with the hip fractures, is not, are our fractures going to heal faster? It's, are our patients going to do better?
Yeah, the other thing is you see there's a number of studies looking at osteopenia, osteoporosis, and dietary. And we see that plant-based diets tend to lead more towards hip fracture, particularly because of the quality of the protein in many ways. We certainly do see that. Other topic you were mentioning, I know there's 2 points I want to bring up. I forgot one. But anyway, yeah, so the protein issue. And then the other thing, I think that was, I can't remember. What were you talking about? You had 2 topics just a second ago.
So it's the essential amino acids, and the probiotics 100% can help you absorb your calcium better. Right, because most of the calcium is absorbed through the food that you eat. Where else are you going to get it? So if you have the appropriate bacteria, and it's usually lactobacillus and bifidobacterium, and if you have a better flora, that means that the particular types of bacteria that are active in your gut, they're going to absorb that calcium more. And of course, then vitamin D helps that too. But it's just so much more complex than we were led to believe, right? And as things go along, we try to broaden out our understanding and adapt our practices to these new paradigms, they're new paradigms of understanding. They're not new paradigms of physiology. It's just we're understanding it better.
Yeah, one of the other things with calcium absorption, one of the thoughts was higher protein diets led to hypercalciuria, calcium in the blood. And it was thought that it was leaching from the bones. Turned out protein actually increases calcium absorption across the gut. So it was just balancing it out. So again, higher protein in the diet plus calcium supplementation is probably going to result in better calcium absorption. So that's another reason to increase your protein, whether it's essential amino acids. Just tell me eat steak. That's an easy way to get them, in my view. It helps in that way.
I find that, especially women, oftentimes, if I tell them you just got to eat more meat, they're just like, nope.
Mm-hmm. Yeah, it's a shame that they've been brainwashed into believing they've got to eat salads and a tiny piece of chicken. Yeah, in many ways.
I think a lot of it is they just don't like meat. I think look, there are genetic differences in men and women. I think my experience is more women don't like meat as much as men do. You have to work around. Look, if I could tell my patients, look, if you were carnivore or ketovore, I think you'd be overall healthier. Let's get on that. There's a small fraction of my patients that are going to do that, although those patients do have spectacular results. But especially with respect to women, when I say you need to eat more meat, just a whole lot of them say, I just don't like meat that much. And I say, well, eat more eggs, eat more. How about chicken? Because there's a difference, red meat and chicken. Can you eat more seafood? Get more protein into your diet. And that actually is something that is tested. I didn't see it on this test, but sarcopenia, which is that wasting away of your muscles as you get older, that is well known to be reduced, meaning reducing the amount that your muscles waste away. It's well known to be reduced with more protein in your diet. Everybody who's been in the hospital has probably seen some Ensure, right? The protein drink, right? Yeah. So it's not a secret.
Yeah, the Ensure is not a good product, as you probably are aware. I realized what you brought up, the ADA. So I was just in Oklahoma talking to the legislative body, one of the legislative committees, about their public health committee, about getting some research around beef and diabetes. And they had a dietitian that was a diabetes educator who was, unfortunately, she was pretty obese. And she just came up with the ADA talking points and telling us about, the point was to have her they brought her there to talk about the problem of diabetes and how much it costs the state of Oklahoma like $3 billion a year. They're paying on diabetes care, which is tremendous. But then she said, what we tell our diabetics to eat the same as everybody else, and everybody else should be eating a balanced diet of this and that. And I just said, okay, great. And she was telling about how the things they've improved through that sort of dietary strategy. And I'm like, the average diabetic, even the goals, 6 to 7 hemoglobin A1C, that's still heart attack, kidney disease, blindness. The goals aren't even aligned. And so then I went into my spiel and I said, I apologize. I said, sorry, you're not going to agree with me, but this is what I'm finding, and so on and so forth. But yeah, you still see that within the diabetes population. As an orthopedist, diabetes increases our business. Frozen shoulder, Achilles tendon, all these issues are worse in diabetics, and they're more frequent. And of course, they're more prone to complications, as I'm sure you're aware.
Well, sure. And the reason I started the carnivore diet is all of a sudden I find myself with metabolic syndrome. So I had an increased blood glucose, although not an increased hemoglobin A1C, but a continually increased blood glucose over years. Blood pressure was through the roof, triglycerides, and everything has improved since I went carnivore. My triglycerides went way down. My LDL went up a little bit, but I'm going to do a big 1-year checkup and everything and get a new calcium score and probably a new arteriogram or angiogram. But I now no longer have metabolic syndrome because of the carnivore diet. And let me throw this in real quick. Email me, Kevin Stitt, the governor of Oklahoma, is a fraternity brother of mine. I haven't talked to him in a while. We're buddies. So I would love to maybe.
I literally saw him walking across the parking lot, and the representative that was with me said, hey, let me bring you over to Stitt. And he was just walking too fast, so we couldn't catch him. So I just about had a conversation with him yesterday.
So maybe I could help with that because, I'm from Oklahoma, and I went to Oklahoma State, and Kevin Stitt was a beta with me at Oklahoma State. And I like Kevin a lot. And I think maybe we could get in and talk to him because, Oklahoma plus beef plus health, I like it. So let's
Oklahoma's the number 2 cattle producing state in the country, just behind Texas. They got a ton of cows there, and they're very much a cattle state.
Yeah, so we should. So I just bought a continuous glucose monitor, and I've been trying to figure out what I'm going to do with it. And I think one of the things, I think it's a 2-week. The one I have is a 2-weeker. One of the things I'm going to do is I'm going to eat a bowl of oatmeal. Now, I've cheated a bit. I have to be honest. I've cheated here and there a little bit, but 99.9999% I've been strict carnivore for 9 months. I'd love to show this is what happens when because people are different. Look, I know people who are metabolically super healthy, who eat essentially just whatever they want. And that's just one of those things that's going to happen. It's just the stereotypical 90-year-old grandma who chews tobacco while she smokes and drinks 3 bottles of whiskey a day and she's super healthy. Okay, those are the anomalies. I think most people in America, was 80% of people in America in the adult age group have at least one marker of metabolic syndrome, some shocking number. For those people, I think a ketogenic or carnivore diet is going to make them a lot healthier. And I want to help the whole thing. I want to help the small ranchers and the small cattle producers and pork producers, help them along. I just feel like I want to be in the fight. I feel like there is a fight. I feel the fight is against a very moneyed interest who is very happy. If you look at, we're not going to get too conspiratorial here, but we will say BlackRock and Vanguard and those large moneyed interests who are giant hedge funds who own Nabisco own Johnson & Johnson. Okay. The same people that own the nasty food companies own the medical companies who are selling you the medicines to treat the problems that were created by the food that they're selling you. So it is a battle. It is a battle. And it's not, and I don't want to say that the actors are nefarious. I don't want to say that people that work for the food companies are sitting there in smoke-filled rooms saying, we're going to make everybody fat. I think what it is, they say, we're going to sell the food that sells the most. We don't care how it affects people. That's their problem. So we're going to have scientists who sit in a room and find the bliss point, which is the point at which the fat, sugar, and carbohydrates activate so much that they actually give you a dose of dopamine when you eat it. And then they brag about it. Nobody can eat just one. And they're looking at it from a capitalist framework, which I'm a capitalist. But we have to find some balance. We have to say, what are we doing to our children? When you and I were kids, type 2 diabetes was unheard of in children. It never happened, ever. Never saw it. And now it's common. And obesity. I was the fat kid in my school, and I wasn't that fat. I was fat, but I wasn't like the kids are now. So we're crippling our next generation by turning our heads away and allowing them. And I fight the battle in my own house, man. I have 2 girls, 14 and 16, and they love to go to Hyper. It's like an energy drink drive-through place. They love to go get these giant bombs of caffeine and sugar, and they eat pizza. They go to a sleepover, and they're going to eat boba. I don't know if you know what boba is. It's basically
that tea, that sugar-filled tea stuff, right? Yeah,
sugar bubbles. I'm fighting the fight in my own house, but it is a fight, and we do have to. If we want to be a better society, a healthier society, we have to get out there and get into the fight.
Yeah, I don't disagree. The sad thing is, it took both you and I, same thing. It took our own health being compromised before we finally figured this out. We should have learned this in medical school, but we didn't. We had to wait till we got sick and said, hey, I'm tired of being sick. What can I do to fix it before we woke up to this? Because it's literally not taught to us. And it's, as you mentioned, not to be conspiratorial, but yes, it's certainly, there's a lot of finance, there's a lot of money to be made in a sick population eating junk. That's just the reality of it. And I think more and more people are starting to wake up to this. But now how do you fix it? What do you do about it? Do we just put everybody on Ozempic shots? This is where you see the so-called woo caucus, which I'm tangentially involved in, saying, hey, we need to fix the food system. And we see the result, like the sort of press release from the U.S. government was, oh yeah, chronic disease is an awful problem. Let's fund Ozempic to everybody. Let's get the taxpayer to do that. And so this is what we're seeing, that you've identified the problem, but the solution is our solution, which is, again, $1,000 a month for every person for the rest of their life, which is, it can't be the solution, I don't think. So we have that issue that's certainly there.
So I'm conflicted about Ozempic. I think, so Ozempic is helping some people. There's no question. But you see a lot of people who get on Ozempic and they're like, I'm going to eat whatever I want. and I'm just going to eat less of it. And that doesn't make them healthier. So I think the steps we need to take is we're doing what we're doing. You're talking to the legislature in Oklahoma, and I'm going to hopefully maybe try to help you get in touch with the governor. And we do these things, and what we say is, look, you have to be careful to not vilify. I think you don't want to. I think that when we start using terms like big pharma and big food and imply that these are just super nefarious actors, they're having a bad effect on people. There's no question, but they're also having good effects on people. Pharma is why we have all kinds of medicines that are wonderful for people, right? And big food is why you really shouldn't be starving in America. Although you can make an argument that a lot of people who are obese are actually starving. That's an interesting question to talk about. But I think how we do, they're malnourished as they're obese, right? So they're obese and malnourished, and people don't understand that, but that's the case. But I think we do it without vilifying, and I think we do it by setting example, and that's you set an example of health with your YouTube channel, and I have a tiny little YouTube channel. I'm trying to do that. Mine's more of a transformation story, and look at what this has done to my life. And I really think I can only operate for so long. I have 5 to 10 years left to operate, but after that, I still want to be active in helping people, and that's the idea of my YouTube channel is I may end up getting certified in metabolic health or some tangential medical pathway towards helping people. Eventually, I don't want to take insurance. I just want to help people. I just want to help people get healthier because it's been a struggle. It's been hard for me to get healthy and stay healthy. And that's part of my YouTube channel too, is personal accountability, so that I don't fall back into, hey, let's get some pizza.
Yeah, just to your original point about the vilifying pharma. I talked to one of the representatives. His name is Clay Stairs, and he was the one that got me. We were talking at another meeting I was at in Tulsa, Oklahoma, and I was talking to him. He goes, I said, Clay, because he's new to the legislature. He's like a first-term congressman. He's up for, I think he'll get reelected for a second term. And I said, there's going to be people that don't like this. There's going to be because there's obviously pharma lobbyists that are going to be, there's lobbyists for every congressman. Every state representative has a lobbyist from pharma. So you have to walk that very gingerly, or you have to say, this is an option that we should explore. That's the way I approach this. This is a therapeutic option for patients that wish to pursue this. And I think that's the way to get in the door. And then if you show the results are superior, then it's okay, let's pursue this more and put more funding behind that. But yeah, you're absolutely right that we have to work within the system. And quite honestly, the food companies, pharmaceutical companies are capitalized to the tune of trillions of dollars. If they don't, they can just, you're a bug squash type of thing. So you have to figure out how to do that in a very sort of selective and precise way so you can get where you need to go on that stuff. So that's...
Yeah, and you can also ally with, I live in Iowa. There's actually, I can't remember the name of it, but there's like the National Pork Council and the World Pork Council.
Iowa's a big pork state, yeah, for sure.
It's also a corn state. But here's what's interesting. People don't realize when all of that corn out in the fields, most of that, look at that stalk. That stalk is not edible by humans. They feed that to the cattle. And people don't realize that. It's called silage. And so they feed all the waste from the corn to the cattle. Mm-hmm. And so the cob, the stalk, the leaves, all that, they grind it up and they feed it to the cattle. Cattle eat it and they make meat. I think there's issues. I think there's high fructose corn syrup and too many things. There's a lot. It's a long we have a lifetime of work for not just us, but the generations below us to try to get us to be as healthy. I went to Spain this last summer. Mm-hmm. I think I saw 3 obese people, and I think they were all from America. And
I was in Spain in August. Yeah, same sort of experience. Yeah.
Yeah, and I ate as much as I wanted every time we sat down. I had salami and the what is it called?
Iberian ham.
Yeah, with the acorn-fed Iberian ham. I forget what it's called. Yeah. And
Jamon serrano, perhaps.
Jamon iberico bellota. Bellota is the acorns. And I ate some cheese, and I snuck a few olives. I felt great. I was never hungry. You look at the vending machines over there, and they're selling little sandwiches. They're not selling Snickers bars, and people are just living healthier. And so there are things we can model.
Let me ask you, because you mentioned your channel focuses on, we should get the name of that before we go so people can check you out. But personal transformation. Obviously, if you drop 50 pounds, people notice. People start saying, what are you doing? And obviously, I don't know if you're working, are you doing, I don't know what you're practice, if you're doing locums work, or if you've got your own clinic, or
I'm orthopedic surgeon.
How has the response been locally within your clinic, within your office staff, within your colleagues? Have they said, what are you doing? What's going on here?
So I have been very pleasantly surprised that the patients that I have suggested the carnivore diet to, I have caught up with their primary care doctors and said, hey, I just told your patient he's got to go carnivore, or not he has to, but an option is to go carnivore. And you know what they say? Look, if you can get him to lose 75 pounds, I don't care how you do it. And so they've been very, very welcoming of it. The hospital is everybody's been very welcoming of it. Now, I haven't done some of the things that I'd like to do, which is set up like I said, a clinic with the dietitians where they're talking about ketogenic as an option anyway, and then carnivore, of course. But yeah, no, I've not received pushback. I'm full-time. So I work Monday through Thursday in a town called Carroll, Iowa. It's a beautiful hospital, beautiful system. Just worked out better for my family to move back to Des Moines. So I go out Monday morning and I come back to Des Moines Thursday, and then I have my 3-day weekends with my family. It's an interesting thing, but I love it. I have a great young partner who does anterior hips. I don't do hips, and we complement each other. So yeah, I'm full-time, full throttle orthopedics, plan to be that for at least 5 more years.
One of the things that's interesting, now since I've been doing this, I've talked to a number of orthopedic surgeons who have seen the light. Gary Fetchke in Australia, Doug Lucas down in Carolina, yourself and a few others, probably 4 or 5 that I'm aware of now. And I remember one guy, I went down to his place in Louisiana, he's in Monroe, Louisiana, and he has his orthopedic practice, but he has a side gig where he does a little metabolic health thing. And he says, I like canceling my surgery. I like when my surgery is canceled because I can go over to my metabolic clinic and have more fun. He's having more fun doing that than he is doing what he was trained to do. And his surgery's fun. It's pretty cool.
What's his name?
I forget off the top of my head. I'll have to look him up.
I would love to talk to him about that, because I would love to do that. And then as time goes on, more metabolic and less surgery, because surgery is super stressful. You know how that is. You're cutting into somebody and doing big surgery. It's stressful. And I have probably 5 more years of that full time. But I'd love to then have this transition into more of a metabolic clinic. Yeah. So I'd love to talk to him. We'll catch up.
Yeah, he just read it. He goes by the Fat Doctor. It's like the fatdoctor.com.
Okay.
Fatdoctor.com. He's there for helping people lose weight. And he's, like I said, I remember I went down there and spent a weekend with him. He was we raised money for our company, Revero, and he was one of our investors. And so I spent time with him, and he was like literally excited because he's, oh yeah, they had to cancel some surgery. So I went over to my clinic, and he was actually like, again, he was having more fun doing that stuff than he was the surgical stuff. Because after you've done your 1,000th knee scope, it's okay. It's another day in the office, but you start radically changing someone's life through lifestyle. And I was like, wow, this is really cool and exciting. And in my view, more rewarding, maybe not financially, but certainly from a sense of self-satisfaction that you're actually making a big difference when you do that.
I would say that in certain people, a knee replacement is absolutely just transformative. In a lot of people, it's just, man, I don't have pain every day. Thank you. But in some people, now I'm doing all these other things. But if you get somebody to lose 100 pounds, their life is different. Revero, I do want to talk to you, not waste everybody's time on. I think Revero is a great thing. I would love to potentially get involved in that in some way.
Mm-hmm. Like I said, and this is what a lot of our physicians that we have are doing part-time. That might be like a thought of a part-time where you do it's digital, so it's online. So which the advantage is, obviously it's very scalable, but the other advantage, we have a whole team. Like I said, one of the problems I had is trying to practice metabolic and lifestyle health as an orthopedic surgeon. I had nobody, like you said, refer to a local dietitian, they're going to give you the food, my food plate. Go eat this. This is what we think is right. It's not aligned with the goals that you and I would both have, which would be ketogenic, carnivore diet, elimination diet, and all the other support that goes with it. And one of the things I found is it requires a lot of hand-holding. It requires a lot of just
I'm sure.
reinforcement, accountability. That takes a lot of time, and we're not reimbursed for it. And so it's a lot easier for me to go take somebody to the OR and pop a knee in them. So it's a very different mindset. And I think I was watching a video, and this is Ron DeSantis talking about his hurricane strategy. And he said, look, we've been dealing with hurricanes for 150 years in Florida. And every time a hurricane comes in, it wipes everything out, and then we scramble everybody to get the resources in, and we get the linemen, we get the power back on. He's like, look, we know what's happening. Why don't we just be proactive? We pre-station everybody ahead of time. So yeah, the power goes out, but it's back on in a day or two instead of 2 or 3 weeks. And so it's like, that to me is like you're being proactive. And I think we need leadership like that within the country, but even within medicine. So look, if I can take a person this is the one thing. When I was practicing knee, I put somebody's knee in, put a knee replacement. I do a good job. They'd be happy. 2 years later, they come back for their other knee. And I patted myself on the back. Oh yeah, good job, because this patient liked the result. They want me to do their other knee. But the reality is, I probably, if I was smart enough, could have said, hey, let's fix all your lifestyle. You won't need another knee. And I think that's where we have to get to as surgeons and physicians, to say, let's prevent. I think we have the know-how and I don't know the know-how, but I think the capability to avoid most of this stuff is there. And when we discuss that we're spending $4.5 trillion a year on healthcare, chronic disease being 90% of it, my gosh, we should be like avoiding that stuff, in my view.
Yeah, again, I definitely would love to have a talk at another time about potentially my role in Revero. But you talk about politics, RFK Jr. has just really come out and said our food system is broken. We are killing ourselves with our diets. And just thank God somebody's saying it on a national level. I don't want to get into, not endorsing anybody or in one side or the other, but thank God somebody's saying it.
They should all be talking. It should be a bipartisan consensus issue. In fact, I was supposed to go on Tuesday. I was supposed to fly down to Mar-a-Lago and present to Trump and RFK as part of a panel. And because of the hurricane came in, I got canceled. So I was like, okay, I'm not going there now because of the hurricane. But yeah, we're getting, I don't care what side of the political aisle you're on. We should all be talking about fixing our broken food system.
How do we get healthier? And what other problems is that going to fix? If people are healthier and they feel better and I just went out and had this beautiful mountain bike ride this morning in this beautiful town of La Crosse, Wisconsin, and I'm heading, it's just like my life is just so much more vibrant and happy and healthy because I'm healthy.
You're not depressed, anxious, mad. I mean, we got so many people that fall in that category. It's not good for society when you have a bunch of sick people that are not only just physically sick, but they're mentally sick as well. And it's all related, obviously. So
I don't think you can be mentally healthy if you're not physically healthy. I really don't. I don't think, having been obese and not obese my whole life, I can tell you that when I'm obese, I feel a lot worse about myself and the world around me. And that's what this whole journey has been about and is continuing to be about, is let me stay on this side of that line. Let me stay on this health side of that line. And let me help as many people as I can to get there and stay there. And that's what you're doing too. And that's why I salute you.
Yeah. And like I said, I've been talking about this for almost a decade now. Rick, we're almost out of time.
All right.
What's the name of your YouTube channel? So people know so they can go check you out.
So it's just at Dr. Rick Goding, RickGoding, at Dr. Rick Goding. If you search
at Dr. Goding.
At Dr. Rick Goding.
Dr. Rick Goding. Okay, so just your name, basically. Gotcha.
Yep. And
that's the YouTube channel, Dr. Rick Goding.
And that's all I have. I mean, I'm full-time practice. I don't have time. I put out about
I get it.
Put out one video a week, and I try to get some subscribers. I have about 2,500, and I'm tiny. I'm just tiny. But
it's noble, and it'll grow. And like I said, I think we just need thousands of physicians to wake up to this stuff. And we can do it. It's a matter of enough of us saying we're done with the nonsense.
Yeah, I mean, it's my way of being in the fight.
Thank you for doing that. And we need more fighters. So we'll talk, Rick. We should talk offline about some of the other stuff we mentioned about Governor Stitt and Revero and that stuff. But anyway, thanks for coming on. Appreciate it. Enjoy your wonderful carnivore weekend. Say hi to Carrie and the folks over there for me, Dr. Kiltz and the crew.
I will.
I've been traveling so damn much. It's just like at some point you can't go everywhere, but I'd love to be at some point. So I'm sure we'll meet in real life at some point too as well.
Anyway, thanks. It's inevitable, right?
All right. Appreciate it, man. Thank you
for having me on, Shawn.